For some groups of people, managing their health and basic needs involves complex treatment or care plans and access to a variety of resources. Individuals with disabilities, the elderly, mentally ill people, accident victims, or those with chronic illness are examples of people for whom achieving optimal outcomes is difficult. There may be a number of health service providers and other resources needed in a treatment plan. For some, family members or a circle of friends can provide the assistance needed to manage. But others may not have the necessary assistance readily available. Appointing a case manager is one way in which their health, well-being, and personal goals can be achieved. Case management is much more than simply providing help. It's about coordinating everything required to properly manage a client's needs.
Case management is a collaborative process between the case manager, the client, service providers, health professionals, other resources. It is around developing a care plan with a client-centred approach, monitoring that care plan, evaluating it, reviewing it, maybe changing it. It needs flexibility. The case manager needs to advocate for the client when it's right to advocate for the client, educate the client, empower the client as much as possible, liaise, network. Case management is it's a huge process. There is no one or two words that can describe it.
My clientele usually is elderly, over 70 up to 100, but I also case manage some clients with disabilities, and they are often younger. I had a young girl with 20 and a middle-aged gentleman in his 50s and in his mid-40s. So it's all age ranges and disabilities, intellectual disabilities, physical disabilities, as well as autism or people with age-related illnesses.
Case management aims for the most effective and efficient use of support services and resources.
That's what the case management's about. Keeping the person at the centre of the care is about person-centred care. It's about providing the support and the services that that person needs to enable them to, perhaps if it's an older person, to stay home where they want to stay instead of going into residential care, to help them stay safe, to help them achieve, optimal health.
The strategies we use to keep the case management client-driven and client-centred usually in building a rapport with the client, setting boundaries around that as well, to make clear to the client what can be provided and what can't be provided, to establish really trust and a good relationship with the client and the family or any significant other carers.
Case managers play an important role in liaising with a range of health service providers. They also interact with a variety of other service providers, including providers of personal care, assistance with home maintenance, transport, and help looking after pets.
We are a single point of contact for the client, so there is no 5 different phone numbers on the fridge to be able to ring for the cleaning lady and for the personal care person and for the dog walker and maybe for the lawnmower. If they go into hospital, they ring the case manager and everything gets organised through that one point. They don't have to search and look around for information that they might not be able to find. If they have a question, they can come to the case manager and the case manager will actually go out and do that search for them and bring back the information for them to be able to make an informed decision.